So hopefully everyone can see that. So I just start a little bit with my background, just to introduce myself. So yeah, on my background, I did my undergrad at the University of Bath in the UK. Did sport and exercise science, which was like a 4-year course with a 1-year professional placement. And I was lucky enough to go to Cycling Australia down in Adelaide for that 1 year and work with their track cycling team, which was a really awesome experience. And as a 21-year-old sports science student, to be fully immersed in their track cycling program, working with world champions and Olympic champions, really got me interested in track cycling, and really helped develop some of my specific kind of cycling knowledge in that area. So I came back from that and followed that with my master's at Loughborough University, where I studied exercise physiology, which has then led to my current role as a performance scientist with CSIO, and I'm full-time with Cycling Canada, which is where I work with Wade and a lot of the other IST staff. I've been there for just over 5 years now, so I formally started in July 2015. And my role is really quite varied. It's more kind of the physiology role with our men's track endurance squad, with a really big focus on the team pursuit. But I also do a lot of kind of performance analysis, video analysis across most of the squads, a lot of analysis on our opponents, lots of varied work in the DTE in collaboration with our other IST members and various different coaches as well. And as part of that, I've attended and provided a lot of support kind of on the ground at various training camps and competitions overseas, including 5 UCI Track World Championships, the Rio Olympic Games, and the 2018 Commonwealth Games. And hopefully, fingers crossed, next year will be at Tokyo 2021 as well. And so I wanted to kind of in this talk to talk about kind of real specific physiology, what I do in the DTU, with quite a specific focus on team pursuit, and then finish the talk with some of those real specific kind of performance projects and the icing on the cake, the real like race day preparation type work. So this slide kind of just summarizes kind of the scope of my work and where the focus lies. A lot of it is on that kind of training planning, training monitoring, and the real kind of physiological profiling, and those tip of the iceberg is those real kind of cool performance projects which just add the icing on the cake. So I'm going to talk a lot about team pursuit. So for those of you that don't know team pursuit, just quickly, it's 4 kilometers, 4 riders, and it's basically the fastest team to cover those 4 kilometers. And the idea is kind of each person does a turn on the front, swings off, does a big change, as I'm sure you would have seen that when watching videos, comes to the back, and then you only need to finish with 3 riders. So it's really strategic, and as I'll get to further in the presentation, we can really use our knowledge of individuals' physiology to really get really strategic in how we approach it, and that's shifted a lot over the years as well, which has been really interesting, and you've had to keep up with some of the shifts in sports science as well. But just looking at kind of profiling team pursuit performance, really simply, we kind of look at it as supply versus demand. So really trying to increase that internal supply, our internal physiology, our physical capacity, and really reduce the external demand. And the external demand is things like aerodynamic drag, rolling drag, kind of really technical equipment that we use on the bike to minimize those sort of effects. But the supply is really trying to increase our power output and our physiological capacity. And for the purpose of the talk, that's what I'm going to focus on. So that real internal, physiological supply. So just going to go into a little bit of the theory behind that. So we use kind of the critical power model, which is a model based on power and duration. And it's quite mathematical. It was developed a long time ago, back in 1965 by Monod and Scherer. And it's basically using a hyperbolic relationship between power output and its tolerable duration. And then that power time relationship is fundamentally characterized by 2 main areas. So critical power, which is like the asymptote of the curve, so where this line flattens out here, and then W prime, which is the curvature constant of that hyperbola. And then, yeah, we can create an equation using how that curve is modeled to the data that we have there, which means we're able to kind of predict time to exhaustion at any power output above critical power. Kind of rearranging that equation, we can then able to predict power output that results in exhaustion at any given time. And it's important to note as well that that model is only really reliable for durations from kind of 2 to 40, 45 minutes. And yeah, CP, you know, you don't really can sustain that beyond those kind of durations. And we're not really also able to predict time to exhaustion at or below CP. It becomes a little bit less reliable. So yeah, really focusing in that 2 to 40 minute duration, and kind of also at the pointy end of that, which is perfect for us in track cycling, where our events are kind of 4 minutes, 3.5 to 4.5 minutes long. So that's kind of why we use that. This just shows fitting that curve to real data. So we've just got power on the y-axis and then time on the x-axis here. And this is just an example of data that we collect from our athletes, and then just showing how that curve fits to the data that we have there, and then the calculated CP and W prime from that data. So critical power, there's so many terms out there for threshold, FTP, critical power, like they all kind of mean essentially the same thing, but there are some slight different nuances between them. But we are kind of looking basically at that maximal sustainable rate of aerobic metabolism. And this occurs at the higher absolute and relative intensity than lactate threshold, which is a lot lower down, and really represents that boundary between heavy and severe exercises is critical power. Where the energy supply reaches a steady state and that lactate production is matched by the rate of lactate clearance. So you're kind of on your real limit of sustainability, and it's really closely associated with like time trial pace. And it's also very, very closely associated to like an MLSS. Like CP and MLSS are very, very similar, occurring at kind of 70 to 90% of VO2 max. And then CP itself is obviously associated with a number of those kind of traditional physiological parameters. So it's correlated with VO2 max and anaerobic threshold, and really related also to skeletal muscle capillarity and type 1 muscle fiber. And we also use kind of CP threshold values to help set training zones for our athletes as well. And then W prime is kind of, it was formerly known as an anaerobic work capacity, but in recent research that's come to be like known as quite an oversimplification. It's actually very, very complex. But in simple terms, it is kind of a fixed quantity of work that can be completed above CP, and it's measured in joules. And a complete use of W prime is associated with task failure. So yeah, conceptually, it's kind of hard to get your head around, but we kind of view it as a muscular store of energy, which can be depleted at intensities greater than CP. And then when power output is below CP, W prime has been shown to be reconstituted. And there's a few mathematical models out there. That there's one, called W bel, which we use to calculate the remaining W prime at any kind of time during exercise. And then recovery at a lower power output can be done much faster than recovery close to CP during a race. And yeah, it's quite complex in terms of its physiological determinants, but it is associated with VO2 kinetics, muscle cross-sectional area, substrate availability, and also mental fatigue has been shown to impact W prime too. But then just talking about the team pursuit in particular. So yeah, as I said before, it's a 4K event. It's kind of around 4 minutes. The current men's world record is 3:54, and the women's, I think, it's 4:10. So yeah, it means it's a really, really intense exercise event. And when we kind of look at the domain of intensity, it's predominantly in that severe block. But because of the nature, when we have different riders on the front at different times, it's really intermittent. So there's really high workloads on the front, but then when the rider swings off and gets to the back of the line, it means they actually are recovering a little bit. So some parts of the team pursuit may also drift kind of back into that like heavy exercise intensity domain. And because it's kind of going above CP and below CP slightly, means there's going to be a mix of that ATP derived energy from both aerobic and anaerobic energy systems. So it's really quite a unique challenge to team pursuit. And when we look at that from, energy system contribution, so this graph up here, I think everyone might have seen this from some research papers, but kind of shows the percentage of total energy supply and then related to exercise duration. And when we plot kind of the team pursuit, which is around 4 minutes, you can see that, predominantly it is anaerobic exercise driven. And exercise kind of lasting beyond 75 seconds. Generally, most of that energy output is mostly going to be aerobic. However, it's really important to understand that although there is a really major contribution as well from the anaerobic energy system. Because it's intermittent, it means that the energy that's supplied to working muscles can exceed that maximum rate that the oxidative processes cannot. So the contribution from anaerobic, you can't overlook that. And W prime, the anaerobic work capacity, is always kind of nearly completely used or fully empty towards the end of the race. And I can just see that in this graph here. So on the left y-axis, that's power, the yellow line. And on the right is that W prime, that energy source in joules, which is the red line on here. And you can see that this is like the start of the race, where we've got a big kind of peak in power as the riders kind of accelerate the bike from stationary position. And that means that, W prime does drop there as we are obviously exercising above critical power. And then once that rider's done their turn and they're in the wheels, power, the yellow line here, drops right down, and then this horizontal orange line is kind of CP. So we've got periods here where the rider is below that. Oops, pardon me there, switch slides, move that back. And then they're back on the front again. So that W prime, that anaerobic work capacity, drops down again. And then they're back in the wheels. We've got slightly an increase in W prime because they're really recovering significantly below their critical power in this specific example. And then again, hit the front again, above CP, W prime depletes, and then below CP, it recovers obviously until the end of the race where W prime is kind of really, really low, almost at zero. And this kind of explains just what I've shown there, but when exercise does exceed CP and a rider's on the front during a pull in the team pursuit, no steady state possible, really, really high demands, and the demand exceeds the supply. So that results in this fatigue cascade, which is kind of linked to peripheral fatigue. So a loss of that muscle metabolic homeostasis. So hydrogen ions, inorganic phosphates, those types of metabolites will accumulate in the muscle. And then central fatigue, so group 3 and group 4 afferent feedback, which will constrain that central motor drive and reduce that muscle activation, resulting in fatigue. And then when a rider is in the wheels, so they've done their pull and they're back in the wheels, exercise falls close to or below critical power, and those recovery processes are able to occur. So we can flush out those metabolites in the muscles and start to recover. So essentially, like for the team pursuit, critical power kind of dictates that high sustainable metabolic rate and has a big impact on a rider's ability to recover in the line. So the higher that number is, the higher the power can be in the line. So you're going to be able to recover better. And then that W prime, the anaerobic work capacity, is going to help determine how long you can be on the front for without fatiguing. So it's really, really, really useful for us. And, like I said before, we really want all riders to finish the team pursuit with that anaerobic capacity fully empty and a W prime of 0. So what I've just said, really just the team pursuit does represent a unique challenge, and there's a really, really close interplay between, you need really good aerobic physiology, but you also need that anaerobic kind of non-oxidative physiology as well. And for us, it allows kind of athletes with really distinctly different profiles to have an opportunity for success in the event, as there's kind of different roles and different strategies that we use for different people. And aerobic and anaerobic parameters, they do behave in like an integrated bioenergetic system is what we call it, and kind of means generally if you increase one, kind of leads to a decrease in the other. So if you're doing heaps of aerobic work, really trying to focus on that stuff, then you're going to end up reducing your anaerobic capacity, and vice versa. So it does require quite sophisticated and individualized periodization throughout the year, and the use of different kind of training interventions for different athletes. So we do need a really good understanding of what each individual's physiology is, and also what role they play in the team. And to just put this into slightly a different diagram for team pursuit, like what are we trying to enhance, just breaking it really into its kind of simple components. We have the start, power on the front, which generally lasts around 30 to 40 seconds, and recovery in the line. And then how these kind of link into how do we increase power on the front, how do we increase our start? Well, we want to increase our anaerobic capacity and the rate of those anaerobic energy systems. And then for that recovery in the line, how do we recover better? Well, we increase our threshold, we want to increase our aerobic capacity and the rate of aerobic metabolism. And I'm not going to go into detail on all of these different parts here, but this kind of shows us how like the kind of mechanisms behind those kind of basic levels of physiology. I'll just pick one for example. So like we want to increase anaerobic capacity. Well, then we want to increase actually anaerobic glycolytic energy production in training. We want to increase lactate production in training. We want to increase those key glycolytic enzymes in training. How do we do that? Well, going down to this part here, it's really specific targeted intervals on the bike, lots of lactate tolerance work, lots of very intense loaded intervals like kilos. So yeah, this kind of document, page here kind of shows you just how everything is linked. And by all means, this is not everything at all, but just shows you like from one level to another, what we're trying to do from a real basic physiological perspective, and then how we can do this on the bike, in the gym, and how everything kind of links together. And for the team pursuit itself, there's really different kind of unique roles which are going to impact that underlying physiology as well. So position one is the starter in the team. He would normally start in the gate, and his job is to kind of get the team going up to pace, and is generally more of an anaerobic type of athlete. And then P2, who's the second position, he will take the front after P1 swings up and goes to the back. And that's generally more of a mixed role, like quite a difficult role, because you still need to have that anaerobic capacity and be a really good starter. Like the first pull for him is really important and will kind of set the pace for the team. But you also need him to recover in the line and also, contribute in the back end of the ride. So they're generally quite like a hybrid athlete, like a mixture of the anaerobic and the aerobic capacity. And then P3, obviously he does his turn after 1 and 2 of swing off, and traditionally does like a little bit of a longer turn, and sees the front of the TP a lot more towards the end of the ride, so they're more aerobic. And then P4 is your real like aerobic engine, so the start is kind of less important. Obviously they need to get on, and they do need to have still an anaerobic capacity, but traditionally they're going to do a lot longer turns and then see the TP see the front of the TP right towards the end of the ride. So you want them in that kind of 3 minutes 30 of exercise duration to be shining in the TP. So strategy choice is also pretty important, and will be defined by the physiology of the riders and kind of what role they play in the team. And in the team pursuit, originally it was 1 lap turns that were utilized quite frequently with really regular exchanges, and just a focus on speed maintenance, and each rider would generally see their front 3 or maybe even 4 times in a ride. However, exchanges cost time. It takes about 0.1 second each time, and medals are decided by such small fractions of seconds. So over the last few years, there's been a trend on those longer turns, reducing the amount of exchanges that the teams do and being a little bit more strategic in lap distributions. And just another example here, the world record that was set in the World Championships in February, Denmark rode 3:44 and used really long turns. Like they started in a really long turn, and that was kind of carried on through the race with their P4, that like real aerobic engine, doing almost a kilo on the front, but at the back end of the ride. So really interesting how the physiology can really link into the strategy that you use, and kind of, yeah, I find it really, really fascinating, and it's really, really cool. But also really important to note that it's part of a massive picture. So we obviously focus a lot on CPW prime and that underlying physiology, but yeah, it's really important, I think, as IST to know that that's not by any means the be all and end all. And there's many, many other areas that are going to have an impact. And this slide just kind of shows a few of those different performance kind of foundations that are really important too. So yeah, switching lanes a little bit. So I kind of spoke a little bit just on that kind of physiological foundation of the team pursuit. And now I'm going to just talk a little bit about some of those interventions, those like training stimuli that we use to really kind of enhance training in specific challenging situations. And one of those is heat. So I think everyone knows Tokyo is going to be really hot, really humid. We did a recon trip last year, July, to the Izu velodrome, which showed that conditions are going to be around 28 to 32 degrees in the track and probably 60% or higher humidity. So really, really hot. And obviously those kind of conditions are going to pose quite a significant thermal regularity and perceptual challenge for those endurance athletes. And yeah, potentially increase that risk of experienced heat illness as well, especially people that haven't kind of adapted or are unaccustomed to those kind of conditions. So there is quite a big potential for performance detriment during the Tokyo Games. However, for us, the team pursuit, like I said, it's only 4 minutes long, so it's not really enough time for significant thermal strain to develop or reach kind of a really critical level within the 4 minutes itself. And those hot conditions are actually going to be ergogenic for our riders. So when it's hot, means that there's going to be a reduction in air density, which means that the times are actually going to be a lot faster, and your muscles are actually going to be kept warmer, which is associated with an increase in power output. So the hot conditions itself are going to be beneficial to our guys. However, the biggest risk is actually going to be overheating during the warm-up. So the guys are on their bikes for around 30 to 45 minutes and doing quite an intense warm-up for the team pursuit. So there is a risk that they could overheat during that period and start the race in a detrimental physiological condition. So I came up with kind of 2 interventions to tackle this. First one is like a heat adaptation. So trying to prepare for the Tokyo conditions prior to departure. And this exposure to these hot conditions will assist in pre-adapting the athletes to the high temperatures that we're going to anticipate in Tokyo. And the second one is kind of using real specific pre-cooling strategies and techniques. So using fans, ice vests, slushies before, during and after the warm-up to help mitigate those risks. So I'm just going to talk about some of the heat acclimation work that we did. We did this last year, July. And yeah, we did a little bit of research kind of trying to choose what avenue to go down. And obviously there's, active heat acclimation is really popular, where, spend a lot of time outside, 60 minutes in hot conditions, or you can use kind of heat chambers if you have access to that. However, we decided to go down the passive heat acclimation route, purely because it's going to be in a very, very, during our specific preparation and during a taper, where we don't really want to start introducing 60 minutes in a heat chamber. It's going to have actually quite a negative impact on the training that the guys are doing during that time. So we wanted to do something that was quite passive, quite practical, easy to do. We don't need to travel anywhere. So we chose this passive heat acclimation intervention, which involved hot water immersion using like a inflatable hot pool and hot spa. We chose to do 11 days based on the literature out there. And yeah, it was quite a fun intervention. There's just a little picture of myself and my colleague like getting things set up in a room in the velodrome, the heat torture room. So how we went about this, we did some baseline heat testing, which with a goal of kind of profiling each athlete's baseline response to exercise in the heat. This involved them going through their standardized warm-up protocol that they would be doing on race day in Tokyo in some simulated hot conditions. So we got maybe 8 heaters in this tarp tent in this room, which was lots of fun. And yeah, got the conditions in there to around 30 degrees, 32 degrees, I think. So they went through their standardized warm-up protocol. We measured power, heart rate, core temperature using a tympanic, so the ear thermometer, because that's kind of all we had access to. We took perceptual measures of thermal sensation, so just how hot or cold their body felt, and then measures of thermal comfort, so kind of how they then interpret that state. So how comfortable are they in those conditions? And then ratings of perceived exertion, so RPE. Sweat rate, we used the kind of basic weigh in, weigh out alongside fluid intake and duration of exercise to calculate that. And then we also took some blood samples as well, using hemoglobin and hematocrit measures to help estimate plasma volume change, using that Dillon-Costille method from 1974. And then, yeah, just a note on that, we actually used, during that time as well, we were doing some HB mass testing. So we did use the plasma volume, the actual plasma volume that we got from that HB mass testing, and then using the hemoglobin and hematocrit measures, we could measure that change. But obviously there are a lot of limitations using that method. So the protocol itself was, yeah, like I said, 11 days consecutive exposure. The guys were doing exercise prior to these sessions where applicable. So obviously we're not training on the track every single day, but where we could, we did it we did the exposure like straight away after for that extra kind of heat stimulus. We had the water temperature at 40 degrees Celsius, and the duration of exposure progressed from 35 to 45 minutes across that 11-day period. And then the main goal was to elevate core body temp to 38.5 degrees or more. We had some health and safety guidelines. Yeah, obviously don't want to cause too much. Yeah, if anyone was feeling faint or, you know, we'd yeah, have some guidelines to make sure that there wasn't any issues there. We did do a weigh in, weigh out before the protocol as well, just to keep track of what those fluid losses were and to make sure that we could recover the athletes well afterwards. And then we took some core temp measures pre-exposure, and then every 10 minutes in the spa pool when they were there as well. And then, yeah, followed the rehydration protocol after exposure just to make sure the guys were recovering as best they could using those weigh in, weigh out measures. So just going through some of the main findings that we found. So obviously important to note that from one test to another test, the environmental conditions did remain stable. So average of 32 degrees versus, well, 32.7 versus 32.8 pre and post. So the tests were in really similar conditions for the athletes, which was good. And then perception. So we had really kind of significant group mean reductions in perceptions of thermal sensation and thermal comfort for the same warm-up in hot conditions pre and post acclimation. As you can see here, so thermal sensation pre was a kind of group mean average of 7.53 and then reduced to 6.75 after the acclimation. And there's thermal comfort graph there on the right as well. So as you can see, there's, you know, quite a big difference there, significant difference. And then RPE was reduced too, but not quite significant, and a little bit more variation in the responses across the group pre and post acclimation. In terms of core temperature, plasma volume and heart rate, we did observe a group mean reduction in these measures as well, but not quite significant. Just show some graphs here. So this one is core temperature pre and post, plasma volume pre and post. And then that heart rate in that first 2 minutes of their specific kind of threshold interval in warm-up, which was really standardized. You can see slight group mean reduction there as well. And then sweat rate, didn't really see too much difference in group mean sweat rate. And then yeah, so on the whole, there were group trends, and specifically in those perceptual measures. But there were, as you can see on the graphs I just showed, there were quite big differences within the group. So the response was really individual. And we did see that generally the more aerobic athletes that we had show a greater response, and there's been a lot of studies that have backed that up as well, that individual kind of training status does have quite a big influence on that heat acclimation response. And yeah, well-trained aerobic guys are kind of naturally already heat adapted, so they kind of acclimatize faster and are more likely to have that high aerobic capacity than less trained individuals as well. Another issue which could have caused those big differences we saw was just adherence to the protocol. We had one athlete that was a little bit sick, so missed a couple of sessions, and just kind of really making sure the guys were keeping submerged to the neck, etc., doing the protocol properly. And yeah, I did see a few, differences in those core temperatures that we did observe during the protocol as well. So just making sure they were actually adhering to it properly. And then post-stimulus recovery, so making sure that the guys are, doing the right thing afterwards, rehydrating. And there's been a few studies that have shown that protein supplementation can help support that plasma volume increase. So I think the guys that we kind of saw the better responses were those guys that were kind of doing everything right, getting their protein in after, doing all their recovery as best they can. And I'll just show some data on one of those riders in particular that had a really good response. And this graph here, so we've got power on the left axis, time at the bottom, and this is just his warm-up heart rate on the right axis here. And then the orange and the blue lines here are his power output. So you can see he did essentially exactly the same warm-up from pre to post intervention. And then the data up here is his heart rate. So the gray is heart rate pre acclimation, and the yellow is heart rate post. And yeah, you can really see from that graph really significant differences in that cardiovascular response. So just example for this little block here, which was 4 minutes at threshold, where the average power was 375 watts for both of these. Heart rate pre was at 171 and heart rate post at 159. So yeah, pretty significant difference in that heart rate response there. And then this part up here, so 30 seconds at full power, which was around 630 watts, so really similar power for both of those efforts. And then heart rate pre at 168 versus 139 BPM heart rate post. So again, just shows that really different cardiovascular responses from the heat acclimation. And this was shown across some of those perceptual responses for that same rider as well. So he had a reduction in thermal sensation, reduction in thermal comfort, reduction in RPA as well. And then in core temp, so the flat black line is his core temp pre, and the dashed one is core temp post. So pretty consistently different across the duration of his warm-up. And then the biggest one was like a huge increase in plasma volume for this rider, which is kind of shown in that heart rate data, where that heart rate response was significantly reduced. So clearly, to compensate for that, plasma volume would have been increased. But yeah, important to note the context of some of those limitations with how we did measure plasma volume with that data. But yeah, kind of is in line with all the other observations that we saw from this rider too. And again, a nice increase in sweat rate for this rider as well. So I think, key learnings from that intervention was an overall positive response for the group. We did see a group reduction in those perceptual responses. However, there was quite big individual variability. So definitely some responders, which, like I said before, are generally the more aerobic riders, and then non-responders, so more of our anaerobic riders, we didn't see too much of a response. And we are going to do some tweaks to this protocol for pre-Tokyo, which we're going to trial hopefully in November this year, which we'll do during a full kind of competition simulation. So we'll be doing our kind of proper taper and seeing how this intervention can really fit with what we're doing. We are going to change the timing of the intervention to kind of early evening instead of immediately following the track session. because some of the feedback from the riders were that they didn't feel like doing it straight away after training allowed them time to recover properly after the sessions. And using the data that we collected as well, we didn't really see that core temp was elevated. Like by the time the guys have gone, had a shower, kind of cooled down a bit, core temp wasn't really elevated anyway. So we didn't have that kind of extra heat stimulus, which is what we were trying to get from doing it straight away after training. So we are going to adjust that timing a little bit and see if that allows the guys a little bit more time to recover properly. And obviously ensure everyone does adhere to the protocol. So being around for the sessions, make sure the guys are submerged up to the neck and doing it properly to get the best response. And then add in that nutritional piece as well. So just giving them a bit more structured nutritional guidance, you know, to make sure that they are recovering optimally from that heat exposure. So yeah, in summary of the presentation, I know that was a lot of information in a very short space of time, but yeah, high performance track cycling is really complex and it's a really data heavy sport, and I think you can easily kind of get paralysis by analysis. So yeah, for me it's really important to be focused on what are the actual demands of the event and how the physiology can then support that, and what can we do to, you know, change things, increase things with different athletes and how they fit in the team. And then the performance projects, such as the one I've just said, can add a positive impact to the team where appropriate. You know, the specific environmental challenges that we're going to face in Tokyo is something that we need to be prepared for, but important to note, I think, that those projects really are like the icing on the cake. And if you haven't got that foundation, you know, the volume, the aerobic work, then those kind of projects aren't really gonna do too much. So that was it, guys. I'll see if there was any questions in the chat. One second. So from Martina, does a rider's role change throughout their career, or are they usually suited to one of the positions, whatever? Generally, because they are quite specific. So if you are like an anaerobic, you know, more of a sprinter power type athlete, you are kind of always going to be P1 or P2. Like it would be really rare that you'd see someone shift into to P3s and P4s. However, those kind of hybrid riders, so the riders that are like, you know, P2s, you know, we've seen them go to P3 or even P4 if they've got that kind of aerobic background as well. So yeah, there is a little bit, but yeah, generally at both extremes. So the real anaerobic guys are generally going to be the starters, and the real aerobic guys are going to be P4s. I hope that answers that one. And then one here from Claude: do you have any data combining heat and altitude training? If so, any advantage to combine both pre-Tokyo and in line with significant change over zone protocol? Yeah, interesting. And it was something we were considering. Like we did actually have an altitude camp last summer in preparation for Pan Am Championships, which was held at altitude. And I am really, really, really interested in it still. But I think just logistically for us, it's not really too feasible. And as well for our guys, we've only done altitude once. So we've got quite a bit of data on the guys, and there was quite a mixed response. So yeah, something we'd be interested in, but yeah, quite difficult logistically for us to do. And obviously, yeah, financially as well, need some money to go to altitude and collect all this information too. So hopefully that answers that one. Do you have suggestions for adjustment to your program for a typical 40 to 50-year-old recreational athlete with a full-time job? I'm not sure exactly what that question means. I don't know if you mean for team pursuit or what you're doing there. So yeah, maybe you can send me an email for that one, Brian. Bruce, thanks, Emily. How consistent is W prime and how big a role does perceived exertion play in your opinion? Yeah, good question. W prime does change throughout the season, obviously depending on what type of training you're doing. And I think that there's some really cool studies on mental fatigue in W prime, where they've done like a mentally fatiguing challenge, and threshold has stayed the same, but W prime has been reduced. So really, really interesting area. And I do think, yeah, perceived exertion plays a massive role. as I said before, most of the data that we see on the track, you know, when the guys are really, really pushing themselves to the limit in kind of race scenarios, we see W prime at 0. Whereas in training, when we should technically be seeing similar things, like, you know, you want the guys to be pushing and they'll like swing off, and then you look at the data and it's like, well, you weren't actually fatigued by the data that we saw, but obviously something else is going on to make you, you know, have a higher RPE than what the data says. So I think that, yeah, that mental fatigue and the perceived exertion does play a huge role there. So yeah, really, really interesting. One more question there from David. Does training with a mask on for COVID improve VO2 max? Yeah, good question. Don't think so. You can try that one if you want, but yeah, don't think that would.
Thanks, Emily. I think we'll end the questions there. That was fantastic talk again, and thank you very much for all the questions. If there is any other questions, you can post them in there, and Emily, if you want to respond just by typing the answers, that's fine. But I think we'll move on to the next talk. And
yeah, thanks, guys.
Great. So next talk is by myself. So as I mentioned before, I work with both Emily, and I also work with Nicole, our last speaker today, with the track program based out of Milton. I'm just going to pull up my presentation here. Okay. And just want to make sure, can everyone see the presentation okay? So my talk, sorry about that. There we go. Okay, so my talk, basically what I was going to talk about today is medical monitoring of the elite cyclist, and you can apply this to a number of teams. A bit of background: when I first started working with Cycling Canada back in 2016, I received a lot of questions and requests for various different tests that we needed to be doing and should be checking in different athletes. And a lot of it, there wasn't a whole lot of order to it, and they were just sort of random, let's check this lab test, and not a lot of logic to it. So through the years, we've had lots of discussions about what we should be monitoring and what can be useful for our athletes and for our teams. So I wanted to break this talk up into a couple of components. First component is looking more at a sort of philosophical point of view and theory as to what we should be monitoring and why we should be doing it. The second part is the practicality of what we're doing with our track team and what we found beneficial and are working on moving into the future. So what's the purpose of medical monitoring for that? So if we're going to be testing something, we need to know why we're doing it. We can collect all kinds of data, but if it doesn't actually have a purpose or an end goal, then you want to question why you're doing that. How can we be effective in what and how we monitor? And is it practical to perform? There's cost limitations on some of the testing that we can perform. There's logistical considerations. For instance, with the team that I work with, a lot of the times they're not located geographically in the same location. So if we're trying to look at timing of particular testing that we want to do to monitor to optimize performance, that can be an issue as well. Just from a philosophical point of view, I like this quote from back in 2014. The SEM physician needs to strike the right ethical and operational balance between health management and optimizing performance. So I like to use this as sort of a foundation for how I look at what we're doing from a medical monitoring perspective. You always want to be balancing whatever testing you're doing should be first aiming towards the health of the athlete, and also considering the invasiveness and the possible negative effects of too much interventions or too much monitoring with athletes. So you want to strike this balance in all of what you're trying to do with the athletes. Looking back, and this has certainly changed over the years, historically, we looked at more of a reactive provision of medical care. And even when I started with Cycling Canada, it was more of a so-and-so got injured or so-and-so has this issue, come and see them. There wasn't really a lot of proactiveness or looking at what should we be doing as a team and what should we be doing together to help our performance of our athletes. Big problems with this is ignores the contribution to health and performance of chronic injuries and medical conditions. And it also ignores things like the effects of suboptimal health and the absence of injury or illness, such as subclinical exercise-induced bronchospasm, low vitamin D, iron deficiency, and a number of other different factors. So it misses out on a lot of opportunities to address health and medical issues before they affect your performance of the athlete. This has certainly changed exponentially in recent years, especially with teams having full sport scientists and science teams working with certainly the professional levels in most national programs. Further factors to consider that can be complicating issues. Coaches that may not buy into the value of addressing medical concerns before there is a problem and really only want to know if it's a significant issue. There's cost limitations on some of the testing that can be done and logistical considerations that I talked about before. There's potential for athletes to not disclose medical and health information to the coach or the physician out of fear of affecting their place with their team. So if you're looking at monitoring particular medical tests, athletes, you do need to be always keep in mind that they may not want to participate or they may be wary about how that information is being used. I consider myself to be a pretty open physician and very upfront with all of the athletes that I see, and it kind of came to my attention that even with that, a lot of the athletes were not disclosing some important medical things to myself because they had this fear that because I work for the team, they weren't entirely sure how that information was going to be used. So you need to think about these factors, and there's this real or perceived view of the team physician's motive versus the needs of the athlete and the organization. So always keep that in your back of your mind. Even when you have the best of intentions, you're never always sure what some of your athletes are viewing your motives as. So what should our goals of effective medical monitoring be? So I look at it that the primary goal should always be protect and optimize the health, welfare, and safety of the athlete. Secondary goals, prevent injuries and illness from occurring throughout the season and during competition as much as we can, prevent worsening of any existing injury or illness, risk management, and last on here, but certainly not least important, is optimize performance. So if we look at it on a spectrum, on the right, we have complete physical, mental health, and well-being. And on the left of this is multiple injuries, multiple illnesses, mental health concerns, lots of things going wrong with this athlete. And on the right hand, that would be positively correlated with optimal performance, and the left with suboptimal performance. And in the middle of this is the possible role for medical monitoring. One of the goals of us monitoring is to mitigate factors in health that can shift people on towards the right side of the spectrum, as well as optimize their performance and try and keep them from shifting towards the left throughout the season. So effective medical monitoring, clearly defined goals of monitoring. You need to clearly define those with your team and your athletes as to what you're trying to achieve with what you're monitoring, and it will be different for different sports. We'll be talking specifically about track cycling in a little bit. And it's important that the athlete needs to be involved in this discussion as to what we're monitoring and why. It helps a lot to get their buy-in. It helps a lot for them to understand and participate in how this can be beneficial to both their health, but also to achieving the best performance that they can. And it's also important to clearly define the role of testing to coaches and the rest of your, if you have an IST, but certainly with coaches, so that everyone's aware of what the limitations are and what we can and cannot test for, what's useful, what will actually make a difference, and it helps you decide what you should and should not be including in testing for. So how do we do this effectively, and what do we want to monitor? Just a little slide here. So some general areas to look at. So obviously this is more related to an annual health examination, which I'm not going to talk about today, but general areas that we would be considering on a one-off assessment during the annual health exam would be general health, sleep problems, eating disorders, and mental health screening, which obviously have huge importance to health and performance, but I'm not going to be specifically discussing those as part of what we monitor throughout our season. What are we monitoring now as part of our track team? And this is mostly related to our endurance men's and women's teams that Emily works with. Really not a whole lot of things on lab tests right now. So we'll talk about why that is in a minute. So generally quarterly, we're checking CBCs and ferritin levels. We're doing at least an annual vitamin D. Daily, ideally, athlete journaling, and I'll talk about that in a little bit as well. And ongoing team coach and ISTO observations. So we've been proactive in looking for input from everybody involved with the athletes for ongoing interactions and changes in athletes' health or changes in their performance, so that they can be clues to that we need to look a little bit further. So why are we doing this? So some of the big things we see with our endurance programs are overtraining, overreaching, that spectrum of, and we had a full talk on that last week, but that's one of the things that can affect our performance, and we see somewhat regularly with our athletes. Iron deficiency, anemia, and non-anemic iron deficiency and anemia, and then factors that we can actually optimize to improve training and also improve performance related to the above. So overreaching, overtraining, again, we had this full talk last week by Dr. Shallow, which was excellent. And there are some, that recent study that he talked about, and some of that detail was not included in here. I'm not intending on going over that whole talk again, but just some background details. And instances, 20 to 60% at some point in time during their career likely have episodes of overreaching or overtraining of elite athletes. The big issue is once it's established, it can have a huge impact on training, sometimes can be weeks or even longer off of training. And if that's at a key point in your periodization, that can be devastating for an athlete and for the team that they're training with, particularly when you're looking at a team of 4 riders that are all very important. Some thoughts, why are cyclists at risk for this? It sort of depends on discipline and what, not based on any evidence for this, but what I've observed with our athletes is our endurance riders do tend to also compete in road throughout the summer. I think pretty much all of them do. And track riding demands to do team pursuit and the various disciplines associated with it versus road riding are a fair bit different in terms of what the physiology behind it is and what their training is during those seasons. Up until recently, and this is changing with how UCI is organizing the racing calendars. Track seasons tended to be a fall and winter sport, and it blended into a spring and summer road riding course. So during track season tends to be a little bit more focused on a little bit heavier body weight, a little bit more focused on strength and conditioning side of things. And when they go into the road season, it's more ideal to have a lower body weight, but at the same time, you're having an increased energy expenditure, so you can end up with this energy mismatch. Further complicating that, a lot of the athletes are going from a national program where we've got a full IST with nutrition and physiology and coaching, and everyone's working together to keep an eye on the athletes, to teams where we really lose touch with how they're being managed at some of the other their professional teams, and not necessarily the same medical backup, and often that creates some issues for athletes, and we've run into a number of situations where people have come back with episodes of overreaching, overtraining, having to deal with. So what's the best prevention? So the best prevention is early detection, and how can monitoring help with this? So I'll start off with this and then talk a little bit about what we're doing. So this was studies done back, BMJ back in 2016, so monitoring athlete training responses, and really fairly clearly identified that subjective self-reported measures commonly trump as their title says, objective measures. So subjective measures reflected acute and chronic training loads with superior sensitivity and consistency than objective measures. So the point of this is we don't want to be ignoring subjective reports and scales. So how do we do that? So simplest, most effective means is self-analysis with daily documentation. We also, as mentioned before, our entire IST is always looking out for subtle cues of changes in performance, changes in behavior, changes in fatigue and whatnot for that. On the next slide, we have used in the past a scale called a Hooper scale, and I'll show that in a minute. That is, and basically takes all of these different factors, and athletes are ideally supposed to be journaling this on a daily basis, creates a score so you can look for trends and changes of all these different categories, and that can cue you that you may need to look a little bit further early on rather than waiting till someone is really dropping off the scale and running into a lot of difficulty. Regular monitoring of CBCs, so hemoglobin, white blood cells, red cells, and hematocrit, possibly serum lactate. They're usually unchanged, but tend to trend towards lower counts, can be an early sign of possible overtraining. And again, Dr. Shallow talked to about this quite significantly last week. And then just monitoring resting heart rate. There's been evidence that changes in resting heart rate can be an early sign of overreaching, overtraining. So just to show, this is basically one of the scales that we were having athletes use, and basically it's a scale, questions out of, they basically rate their fatigue, stress, sleep, soreness, enjoyment, irritability, health, rest, and it's not necessarily important individual one-off of these, but it's important to look at trends in these. So these are often copied to members of the IST and often to myself. So you can look for flags that there's a change in what's going on with an athlete, and just cues you to look a little bit further and probe some questions. And there's been at least a few athletes where they've sort of been filling these out and not really noticed that their scores have changed. And on sort of inquiring with them, they did have some issues they wanted to talk about, so they can be very useful. And encourage you not to underestimate the power of self-analysis and subjective scores. So what about hormones? And again, this was talked about a little bit more detail last week with Dr. Shallow, but there's a whole bunch of different hormones we can test. The newer studies presented last week pointed towards possibly testosterone resting may have some evidence towards diagnosing overtraining syndrome. But when you, at the end of the day, currently when you look at it, there's a whole bunch of markers we can look at, but none of them really meet all the criteria to make their use generally accepted yet, but that very well could be changing. So at the present time, we've chosen not to test these regularly unless there's specific issues we're looking at for the roles. It's just not entirely clear what we would do with that. So the other issue would be iron deficiency anemia, non-anemic iron deficiency. And again, this is something I looked into quite a lot when we first started working with the team. Iron supplementation is fairly ubiquitous amongst most endurance sports. And when you start looking into the data behind it, there's a lot of smaller studies, but not a lot of clear evidence necessarily on its usefulness. But it will go through sort of some theory behind what the evidence shows currently for it. So general population, 3 to 5% of females are anemic, 1% of males, 11 to 15% are iron deficient and non-anemic. So in that they have low iron, but they're not considered anemic at that point. When you look at endurance athletes, low iron we consider between 12 and 35 micrograms per liter. The incidence goes up to 20 to 50% of females, and the ratio for males is 4 to 50%. And so quite a bit higher than the general population, so point to something going on. Multiple proposed causes, and just a little bit of background, which we'll talk about in a second. Multiple proposed causes, so ferritin. Serum ferritin is proportional to ferritin stored in liver, therefore it's a reasonable reflection of iron stores and a really good screening marker for athletes. So why is iron important? Essential for red blood cell production, obviously important in aerobic sports and activities. It's also essential to oxidative ATP synthesis. So if you don't have enough iron, it can impair your aerobic ATP synthesis and increase your reliance on anaerobic metabolism. So basically it can shift you into anaerobic metabolism earlier than you anticipated. So in a sport like a 4K team pursuit, that could be really important. If you don't have enough iron stores, you can see negative effects on performance, less than optimal adaptations to training, specifically altitude training, which we'll talk about in a few slides. And it's important you don't have to be anemic to see the effects of low ferritin on performance. So two separate scenarios. Does iron have effects on performance and iron deficiency? So a couple of studies, they iron supplemented a group of iron deficient anemic female athletes, found that by supplementing those athletes versus non-supplementing iron deficiency anemic athletes, improve their endurance and VO2 max using standardized treadmill tests. It's a fairly old study, fairly intuitive as well. Then you look at the non-anemic functional iron deficient. So those athletes who aren't actually anemic, but their iron are between 12 and 35, which is a fair number of athletes I've seen over the years with cycling. So they did the same study basically where they iron supplemented those athletes during a 4-week aerobic exercise, 4 week of aerobic training, and found that the supplemented group showed greater improvement in endurance than the non-supplemented group. So is iron treatment beneficial in iron deficiency but non-anemic IDNA endurance athletes? Summary of those findings, iron treatment, both oral and parental, and we don't do a lot of parental iron injections anymore, but they both are effective at improving the iron status of iron deficiency but not anemic endurance athletes. The effect of the iron treatment on serum ferritin appears to diminish if the treatment continues beyond 80 days. An improved iron status following treatment may enhance VO2 max. So now we'll get into altitude training. So fairly common altitude training blocks are pretty common in endurance sports. And why do we do them? One of the main goals is, other than a number of other physiologic advantages, one of the main goals that we're talking about today is to increase erythropoiesis. Typically, these are 2 to 4 week training blocks at altitude or simulated low oxygen environment. This is not a talk on altitude training and all the different methods of doing it. There are a lot of different ways you can live high, train train low, live low, train high. Not looking at that today, but just strictly on theory of altitude training and the role of possibly supplementing with iron. So how does knowing your ferritin levels factor into this, and how is it useful? So the effects of altitude training, we know that prolonged altitude exposure increases oxygen transport and utilization due to relative hypoxic exposure. There's also an absolute hemoglobin mass increase, and there's a number of non-hematologic processes and adaptations. Altitude exposure is associated with a 3 to 5-fold increase in erythropoiesis. So can we capitalize on this response to enhance performance, or do we just rely on athletes' just natural response to altitude training? So is there any way that we can improve on this? So altitude training and hemoglobin mass production. So does iron supplementation before altitude training affect hemoglobin mass production? And hemoglobin mass is it's just a little bit more accurate. It's a much more accurate way of your actual hemoglobin because it's not affected by dilution. So it's a preferred method for measuring hemoglobin changes. Govas et al. Looked at hemoglobin mass response to altitude based on pre-altitude ferritin levels in response to prescribed iron supplementation. They looked at 3 groups. I've listed 2 here, but the 3 groups were athletes with a pre-altitude ferritin level of less than 20, those between pre-altitude ferritins at 20 to 35, and those between 35 and 100. So interestingly, they found that athletes with a pre-altitude ferritin less than 20 who were supplemented with iron benefited the least, actually, with only a 7% change. Those who had iron levels between 35 and 100 actually benefited the most in terms of supplementation. So this often would be a group that you may not consider supplementing because they're not anemic. You think they have an iron level of 35 or even 50 or 70. You don't need to supplement them prior to their altitude block, but they actually showed the most in terms of hemoglobin mass increases during altitude training. So kind of summary is, if altitude training is part of your program, knowing your ferritin level can really help guide supplementation suggestions to optimize your benefits from your training program for this. And it's not simply looking at those who are actually in that iron, that very low iron level. It's really that middle range that can benefit the most. It's also important to consider the timing of when you're checking ferritin levels. So it can't be 2 weeks before they're going away on their training block, because you're not going to have time to increase their iron. Optimally, we want to get their iron up before they get to their altitude block. So basically, we need sufficient iron stores needed to support an increase in heme synthesis and iron-dependent enzyme production. So general guidelines for athletes at sea level recommend supplementing athletes with ferritin less than 35. For athletes at altitude, supplementing if ferritin levels are less than 40, we're recommending that they be supplemented at least a month or more before they're headed off for their training blocks. So basically, I just want to look about what we were sort of talking about today. And in general, other than general screening, and if athletes have particular medical problems, obviously we monitor a lot more. But for the most part, this is what we're looking at on a regular basis. Never forget about the importance of your annual health exam as to guide what you do want to monitor throughout the season. Our in-season monitoring, we want to look at what can impact on health, training, and ultimately performance, all in concert. We're checking vitamin Ds annually, or at least before the winter months. You can make an argument to just supplement all athletes in the winter months, but we are checking vitamin Ds annually just before winter. CBCs for a number of different reasons: track hemoglobin levels, identify anemia, early signs of OTS, etc. Athlete journaling, sorry, I actually left iron off of this slide, but we're measuring iron as well. Athlete journaling, I've found one of the most helpful things for, most helpful monitoring tools for identifying a whole host of potential problems and just pointing in the right direction rather than letting things get a little bit too out of hand. And then the other thing, ideally, which isn't always possible, is trying to check in with the athletes periodically, both to review their lab results. So it's not just between you and the nutritionist, or you and the physiologist, or you and the coach, that you're actually sort of talking about why he did it and what the results mean, and gives you that opportunity to ask a little bit more in-depth questions from there. And then performance measures, CBC, ferritin, used as a guide to recommend supplementation to optimize your training, both in iDNA as well as iron deficiency anemia. And then obviously we're talking about the altitude training at the end of the talk. And with that, I'm going to, if there's any questions, I'm just going to check. So for first question, so last week, one of the athletes had a ferritin of 18, and this was not considered a significant contributor to the OTS for that. So just as Scott was talking about last week, so ferritin in itself is not diagnostic criteria for OTS. It can certainly be a factor. With this particular athlete who I followed over a number of years, he had this chronic low ferritin in the 18 to 25 range. But where it did come into a factor and he did notice a benefit was when we actually supplemented him and got his iron up to 35 for when he was going on his altitude blocks. So it wasn't really in relation to a diagnosis of OTS. It was more in relation to, for him, at sea level, that seemed to be fine for him, but it did seem to contribute positively for him when he was on his altitude blocks. And next one's from Surprise, You're Monitoring Lactate. And we're not actually monitoring lactate. That was just actually one of the studies suggested it can possibly have an impact. And we aren't monitoring specifically for that reason, as I'm not entirely how to use that currently. And next question is from Michael Clarefield. How do you coordinate with UCI requirements? So I'm so I'm going to sort of guess at what you're getting at there. So UCI does mandate that certain athletes, if they're ranked, I believe it's in the top 100, have to do twice a year testing of various different lab results and blood results. For that, I really try not to over-investigate our athletes more times than they need to be poked and assessed. And when you look at how many times they're getting tested for WADA and whatnot, you want to try and coordinate that. So we do try and coordinate that with UCI as much as possible. The UCI gives 2 periods, which have about a 3-month window. So it's fairly easy to tag on some of the tests that we want to do to what they're asking. So it just sort of makes things a little bit more seamless with our athletes. One of the other difficulties, as I mentioned a bit ago, is more sometimes geographically it's difficult to get testing done on our athletes. COVID's been a little bit of a help because they're basically all in Canada until recently, but when they're in Europe or around the world for extended periods of time, it's sometimes hard to time lab investigations, ideally when you want to. And so next question's from Dr. Wesner. So are all of my athletes on iron and vitamin D? I will say no. We do check our irons regularly, and I'm happy to say that a lot of them are in quite a normal positive level. So they are not all on iron. Vitamin D, because we have been testing it, I've actually found that a lot of our athletes are certainly well adequate on what they have. So rather than just blanket test recommending vitamin D for everyone, we've been more reliant on testing them going into the winter months to see what their baseline is. A little bit of that was also sort of cost, because the athletes are having to pick up the cost of the vitamin D testing, which isn't huge, but that was one of the factors why we were trending away from not testing it routinely. But now we are. And just take one more question. So from Dr. Shear, the data seem to suggest that supplementing iron in altitude helped those with higher ferritin, but you're recommending supplementing those less than 40. Yeah, so the range in that particular study, the ones that benefited the most, the range of people that benefited the most was those that were between 35 and 100. So it's a fairly large range for that. And this is specifically prior to an altitude block. It's not supplementing them on their sea level training for that. So it was a fairly wide range that was looking at. It was a bit interesting to see that those who were actually quite low in their base pre-altitude iron levels did not benefit. They actually benefited the least from the supplementation. And I think we're just going to I can sort of respond to the last question there. I just want to move on to the next talk so we sort of stay kind of on time for that. And with that, I'm going to introduce Nicole Springle. Nicole popped up on your screen there, which is fantastic. So I basically asked Nicole's our nutritionist that works with our track program. And I've asked her to do a talk on nutrition, which is obviously a very, very large topic. So we narrowed it down to looking at nutrition assessment strategies to support multi-race cycling competition performance. So hopefully, I hope you all find this quite useful.
All right, thank you, Wade. Okay, so yeah, to get started, when I was told that I had 20 minutes, I kind of freaked out because I said I can easily talk for 90. 20 is a little bit more difficult. So I said, okay, I'm going to pick something very specific. So we landed on kind of talking around support with multi-race cycling events. And a lot of the nutrition concepts will still apply to multiple race situations, but this allows me to be a little bit more directive. And then, of course, I'm happy to answer any questions that pop up. So before I get into the objectives, just a little bit about myself, I guess just to get to know me. So I do work with Wade and Emily with the cycling team in Milton. And I've actually only worked with the team for about a year now, but I have been working in high performance sport for the past 8 years, and I also lead the nutrition department at the Canadian Sport Institute, Ontario. So I've worked with everyone from wheelchair basketball to figure skating to beach volleyball and now track cycling. So it's been a really fun sport to integrate into, and yeah, I'm really excited to be here tonight to go through this. So in terms of the objectives for this presentation, I wanted to outline nutrition recommendations related to enhancing performance and recovery in multi-race cycling events. I also wanted to introduce the practical application of nutrition and hydration strategies. I think all of you are well versed with looking at literature and can very easily read all the papers. And what I found in interacting and teaching physicians about nutrition over the past few years is that what kind of gets lost in translation are those practical applications of the research. So I wanted to take a little bit of time and use tonight to go through some of that, and then also review and troubleshoot some potential outcomes of not meeting the targets. And I'm hoping with this to again be able to make it a little more practical for you if you're seeing athletes, whether you're supporting at an event or following up with athletes outside of an event situation, is where can nutrition sort of integrate into some of the assessment that you'll be doing. And I'm going to try and do that in 20 minutes. That's my goal. All right, so as an introduction, basically what we will be talking about, obviously, as you've gotten the gist, we focus on track cycling, but I wanted to highlight that basically in terms of the physiological responses, we'll be looking at track cycling, but it could also be applied to criterium events as well. So both of these are held over successive days, and both involve repeated high power outputs and then short periods of recovery. So these are probably the race formats you'll be able to most apply these recommendations to, but as I mentioned, various race conditions will also be well suited for what we'll be talking about. So in terms of these situations, important thing to know is that, as Emily actually outlined for you, is that both of these race formats really stress both the aerobic and the anaerobic systems. So these athletes need to have well-developed systems to facilitate both of those stresses. So how does this impact their nutrition needs? Well, what we know is that they spend a considerable time near or above their individual lactate thresholds, and that puts significant stress on their glycolytic energy pathways. And so what that means from a nutrition standpoint is obviously that carbohydrate is going to be their prime energy substrate, and it's going to be required in high amounts during these periods in order to replenish their glycogen stores. However, of course, carbohydrate isn't the only thing they're going to need. So in these periods, protein is going to be essential for muscle repair between events. And fluids are, of course, important for temperature regulation and for adequate recovery and getting rid of excess metabolites. And then we also do know, and I'll be touching on this just a little bit because you only gave me 20 minutes, is that certain supplements may be beneficial to enhance performance and support recovery. So unfortunately, we won't be able to cover the gamut, but I will give you a couple resources in case you are interested in going into more depth in terms of the supplements. Before we get into the nitty-gritty, one thing I did want to share as well is, all of the things that I'm talking about, like all of you know, being practicing physicians, is that what happens in the literature is lovely, and as we've talked about, the practical application is a whole other story. So just knowing that you do need to trial everything in training, and that's something we adhere to in our practice, and really individualize these recommendations. So we'll go through the recommendations, and then with that in the back of your mind, that all of these are kind of altered based on each individual athlete. All right, so as Emily started out with, we'll go through, the pyramid, because we all love using pyramids. So in terms of performance nutrition, I wanted to set up kind of my personal philosophy and something that we use as a team at the Canadian Sport Institute, is we do have a hierarchy in terms of the way we address the performance and health needs of our athletes. So on the bottom, we look at whole foods. So we look at their base diet and ensuring that they're getting good whole foods that can supply the majority of their needs, and that all of our athletes are trained on how to use food first. So we do have a food first philosophy. On top of that, of course, we layer on sport foods and various things that are specifically constructed to support the needs of athletes, whether it's pre, during, or post training. And so this is something we also rely on after the athletes have, again, utilized whole foods as a base. And at the very top of the pyramid, even though most athletes like to think that this is at the base, we of course have our supplements. And these are sort of the icing on the cake that once we tell our athletes, once you've figured out the bottom part, then we can layer the supplements on top. So that just gives you sort of a foundation in terms of how we look at nutrition and where our priorities lie. All right, so we're going to start right into pre-race nutrition. So when we're looking at the nutrition goals of the athlete, we want an athlete who's optimally fueled and hydrated before getting into a race situation. So what does that look like? So in the 24 hours before, I'm going to go through some of, again, the kind of concrete recommendations, and then we'll break this down and to make it a little bit more practical. So from a carbohydrate perspective, we're talking 7 to 12 grams per kilogram. Again, we'll break this down a little bit more. Suffice to say that's a pretty high level, and reason being, again, going back to our energy systems, as these athletes need to be well fueled and their glycogen stores well stocked with carbohydrate. So we have a preference for high GI, low fiber in these cases, mainly because we don't want excess fiber and solutes in the gut. And so the high GI or glycemic index is, again, just easily digestible and absorbable carbohydrate. Every athlete's a little bit different. Some, you could feed chili to and they'd be fine, but for the most part, if you have an athlete who's complaining of some gut issues, and especially those I find who are very nervous, they're going to deal much better with lower GI carbohydrates, and especially at the level of 7 to 12 grams, you're talking about some large volumes of food, so you don't want the higher fiber content that would go along with that. In terms of protein, 1 to 1.2 grams per kilogram, pretty consistent with kind of the regular daily training requirements. Fat, there's not really any specific recommendations out in the literature. We generally say moderate to low fat, with an emphasis on the anti-inflammatory fats. Again, they're going to be in a pretty heavy inflammation period, so anything that can kind of combat that is quite helpful. In terms of pre-race, there's kind of some specific guidelines, again, in those 3 to 4 hours before the race. We want to look at carbohydrate levels in the range of about 1 to 4 grams per kilogram. Protein and fat, not as specific. So again, we're not looking at these as a direct supply for energy. So again, it's how the athlete tolerates them. For some athletes, again, they can eat a massive volume and they're going to be fine. For other athletes, I'm working predominantly only carbohydrate within this period. In terms of fluid, average is around 5 to 7 milligrams per kilogram. However, if an athlete is very dehydrated, so if they notice they're not peeing or they have dark yellow urine, then we would also top them up kind of leading into the race start. And then during the race, carbohydrate, not as important. As Emily said, we're dealing with pretty short events, so we're not looking at it being an energy supply issue during performance. But you have to remember that these athletes are going through periods where they're coming in, they're warming up, they may be racing one race for sprinters, they may have a break, they're racing again, it's back and forth, so it can actually extend over a couple of hours. So I did include that sort of 30 to 60 gram per hour mark, because we may need to kind of top them up through their race period as well. In terms of mouth rinsing, we want to keep that in mind, just in terms of the research that does indicate that just simply by swishing carbohydrate in their mouth, that they can stimulate sensors that can also impact performance. So in this case, because we're indoors, we try to get them not to spit on the track. However, just simply rinsing their mouth before they swallow can be also beneficial based on some of the recent literature. And then in terms of fluid intake, we used to say 500 mils to a liter. What I've seen after years of practice is everyone is so different. You really need to test out with an athlete in training to understand their fluid needs. So the goal of that is to maintain within 2% of their initial body mass. And again, ideally the athlete would understand and know what that is based on their sweat rates that they had calculated in advance. Because unfortunately, thirst is not always our best indicator here. So as I mentioned, I wanted to put this a little bit more in perspective. So what I've done is used a sample athlete here, and I used a 65 kilogram female athlete just to also emphasize some of the volume. You know, we're using a small female athlete, and you'll start to see as we go through this that in terms of amounts, it does still get pretty high. So when we're talking daily carbohydrate intake, you know, in the range of 450 to about 800 grams of carbohydrate if we're dealing with that 7 to 12 grams per kilogram. And I'll break that down a little bit further, but hopefully most of you can contextualize it's a fair amount of carbohydrate going in. And especially on a race day, we're gonna look at that in a future slide, but it can be pretty challenging, and the athlete has to actually be really on top of their nutrition, or they're likely not going to meet those targets, as we've seen with many of our athletes. Protein, pretty reasonable, 65 to 78 grams. In terms of the pre-race, you can see the recommendations there, and then during. So what I thought might be helpful to put this carbohydrate into a bit more context is to show you some common carbohydrate contents of foods. And I think this always, and especially when I do this for athletes, this is a common slide I'll show them, is it starts to put into perspective that, you know, 450 to 800 grams starts to become a little more daunting when you think about a piece of toast being 15 grams. So again, to put into context, if we were just talking about a piece of toast, that would be 30 slices of toast in a day to meet the minimum amount of carbohydrate. So this isn't always easy, and it does take an athlete, you know, it takes an athlete and myself usually some planning to really figure out what that looks like in the context of, you know, nerves and race timing and all of that. So I've actually prepared something a little bit later to show you how that would actually work in a day. But I always encourage, you know, especially if you're talking to an athlete and dealing with some of the issues around fatigue, carbohydrate intake is a really good one to look into. And if the athlete is telling you that they had a salad, you know, for lunch before racing, you can probably guess that they're not meeting their carbohydrate needs. So it's a good one to kind of keep in mind as you're, you know, reviewing dietary intake with an athlete. All right, so switching over to post-race nutrition. So what are we looking at here? Well, the goal is we want the athlete to be optimally refueled and rehydrated before the next race starts. So especially in multi-day events, this can be, you know, a pretty short time period between the next day. And also for many of our sprint events and sometimes for the team pursuit as well, we're talking sometimes minutes and sometimes hours between races. So the faster you can get on top of things and the more aggressive you can be with some of the rehydration and refueling, the better results you're going to see. So within 60 minutes post-race, and I tell my athletes ideally as soon as possible, we want to be getting carbohydrates in. So this is in the range of 1 to 1.2 grams per kilogram. Again, this is a really important time where we're looking for high GI, low fiber. We don't want anything to complicate getting that glucose into the bloodstream. So we want to minimize fiber and get the sugar up. I tell them this is the time you get to eat all your favorite sweet things. And in terms of protein, right afterwards, we do want to be mindful that we want to be starting the process of muscle protein synthesis and some of the adaptations that we need for repair of the muscle. And research tends to be around 0.3 grams per kilogram. And some research is now erring towards 0.4 in some cases. So it's somewhere in that range. With fluids, we look at replacing 1.5 liters per kilo of body weight lost. And again, sometimes that's possible to understand. Other times it's just going to be an athlete, you know, knowing from practice around what they need. And then something else I now include all of the time when I do talk about fluids is sodium requirements. And we'll go into why that's such a big number in a minute. But suffice to say that if you don't have the sodium, you might as well forget about the water, because it's probably not going to stick in them very long. All right, within the 1 to 4 hours post-race, also important to remember that if an athlete isn't, you know, sitting down and having a full meal, you need to continue with replenishing carbohydrate within that period. And again, especially if you're talking hours between that next important race, same recommendations apply, 1 to 1.2 grams per kilogram. And then, especially when we're talking about, often with crit races or with track cycling events, it's an evening competition. So we want to be mindful that we do want to enhance any recovery that's happening overnight. So from a kind of pre-bed specifically, we want to look at, again, enhancing that muscle protein synthesis and repair there. And that can sometimes be a challenge overnight. So the most recent research is suggesting that casein protein is beneficial, and that the targets are actually much higher than in that post-exercise window when we're using more of a whey protein base option. So with casein protein, much slower acting protein, and we're looking at 27 to 40 grams in that window. So again, to put this into perspective, in a 65 kilo female athlete, carbohydrate ranges you can see, protein, usually for most athletes we're talking 20 to 30 grams. And then, yeah, rest is pretty self-explanatory, but I wanted to give you a couple of numbers to refer back. And I apologize, this is a little kind of word heavy, but I wanted to, I know when I go to, conferences or look back at presentations, sometimes it's nice just to have a summary. So I wanted to at least have this for you so you could kind of look back at a slide quickly and get a good snapshot. So here's what I wanted to flip over to protein content of food. So in the lead up to your event, as we talked about, really focused on the carbohydrates, very important afterwards as well, as far as glycogen replenishment. But here's where we do need to focus a little bit more specifically on protein, is in this kind of recovery window. And so when it comes to protein, this again is one of those areas where we need to be mindful of, the amount of food that people actually eat and protein content. So it's lovely to say, foods contain a high amount of protein and look at that in, 100 grams of every food, but that's not the way people eat. So what I've done here is tried to give you an idea of what is a typical, portion size that an athlete may intake. So you can see right at the top, pretty easy for an athlete who's eating meat within their recovery period to get protein. 3 ounces of meat, good old palm of hand size, or at least my palm. So pretty small amount, deck of cards. It's really quite easy. Where it becomes a little bit more challenging is generally with our athletes who are either too nervous to consume, heavy protein or potentially dairy between events, or for our vegetarian athletes, we do need to be a little bit more conscientious of the amount of protein they're getting, and also the types of protein, ensuring that they have all the amino acids. The other thing I wanted to point out is in that pre-bed, we talked about casein protein, and that doesn't mean that an athlete needs to invest in a casein protein powder. Casein protein is the protein in dairy. So what I've highlighted here are all of the dairy proteins. And so I'm a big fan of suggesting Greek yogurt or cottage cheese as a bedtime snack for athletes, because it's an exceptional way to get, calcium and magnesium and other nutrients that the athlete needs, as well as that casein protein. So yeah, as I said, food first is always our choice, but what you will see in a few slides is in certain cases, we do have to go towards using some supplements as well. All right, in terms of fluid and electrolytes, this is where I wanted to go back and pause a little bit on the idea of pairing the fluids with sodium. And the reason is that in terms of rehydration, this is pretty vital. So one thing to be aware of is in situations where the athlete has a little bit longer, we don't have to be quite as aggressive, but what we do see in the research is that any of the beverages that do have a higher osmolality will have better hydrating properties than water. And I'm often reminding my athletes that, milk and sport drinks have a pretty similar electrolyte composition, except with milk, you're going to get extra protein, which is going to help with your recovery as well. So just educating them on other options other than just, finishing and chugging water. When we're talking about rapid rehydration, so again, when we have those small windows between races, and also for athletes that just have, difficulty maintaining their hydration, and again, may have a race the next day, this is where we want to be a lot more aggressive with sodium replacement. So you want to be conscious that the sodium levels should be greater to or equal or greater to what you're going to see in sweat, which is in the range of 20 to 80 millimoles per liter, which, as you can see, and when we talk about milligrams, is a pretty large range. So general recommendations, pulling from some of the research that has been done on elite athletes, is aiming for kind of that middle ground around 60 millimoles per liter, or about 1,400 milligrams of sodium per liter. And again, you're looking for a volume of 150% greater than fluid loss because of urinary losses that are eventually going to happen. So when we look at that, again, I wanted to put this in the context of real food. What does that look like? Well, 2,300 milligrams is approximately a teaspoon of salt. So I have had athletes ask me if they can just, dump a teaspoon of salt in their water, and I tell them, of course you can, and that I indicate that I'd love to watch them drink it. So most athletes will not be open to doing that. So using foods that they can also benefit from in recovery is a much easier and more palatable way to go about this. So you can see I've listed in kind of different food groups a couple of the higher sodium options. Something like pretzels is great. They can get some carbohydrate in there, plus a significant amount of sodium. As I mentioned, things like cottage cheese is another great one. You're going to get some good casein proteins plus some sodium. So that's actually a really great one, again, before bed, especially for athletes that have often take trips to the bathroom. That's one of the troubleshooting things that we'll often do is, are you having enough sodium in your pre-bed snack? So that's a really great one. Even things like for travel, a lot of athletes that I work with use beef jerky, really easy, high protein, high sodium option. So again, just wanted to kind of put in perspective that, lots of foods have sodium. So it's just being creative in terms of what you're using at different time points. I also wanted to give you a couple different ideas around some of the options that are available on the market. So, not to go through them all, but I've listed a couple of the different products that are higher in sodium. Even when you're using things like Hydrolyte and Noon, generally to get the levels that we're talking about, you do have to use quite a few of them. And then again, to point out something like a cup of cottage cheese, fruit, and a handful of pretzels, you also get 1,300 milligrams of sodium. So just depending on the athlete preference and their tolerance, you can use ready-made products or real food. All right, so as I alluded to, I did want to give you a bit of a snapshot as to what a typical day would look like if we're putting this all into practice. So a bit of a busy slide, again, more from a reference standpoint, but this is actually adapted from a plan that I did for one of the athletes. So this was a race day where they had, a morning race and then finals in the evening. And so what we did was walk through, okay, what does it look like to meet, your carbohydrate, your protein, your fluid, and your post-exercise sodium needs. So you can see with carbohydrate, we were pretty specific around putting them in, each of the meals, as well as getting in some kind of pre-race options and direct post-race. So I indicated before, for some athletes, they can tolerate food very well, for others not so much. So for instance, in this post-race, you can see we have an option that is a pretty easily digested and very simple sport food only option. And this was if she was really nervous and didn't feel she could handle anything. It's sport drink powder, scoop of whey protein, and some water. We use a sport drink powder that's quite high sodium, so that took care of that. But we also gave the option of just making a smoothie. So that could be, some berries and bananas and yogurt and milk to get some carbs and protein, and then adding a bit of salt to that to just meet your sodium needs. So there's a few options for each one. As I mentioned earlier, we've got cottage cheese, one of my favorites. It always kills me when the athlete doesn't like cottage cheese. 50% of my bedtime snacks are gone, but that's an option there. So you can see in terms of the carbohydrate, we just kind of sat in the middle at 590 with this meal plan. And why I have protein there with kind of the exclamation mark is so many athletes are so concerned about their protein intake. I can tell you, if you are meeting your carbohydrate needs from 7 to 12 grams, you will have no problem easily meeting protein at that point. So the biggest thing I work with athletes on when it comes to protein is your timing, is making sure sure they get it in that recovery window in sufficient amounts. But in terms of total daily protein, it's usually never a problem. Fluids, again, this looks pretty aggressive, but you have to remember they're on the bike for a significant amount of time, so that would be happening there. And then sodium, I didn't calculate the entire day, but just really pointed out where we were specific about choosing higher sodium foods and putting them in strategically before and after races so that we can maximize fluid retention. All right. So I wanted to, as I said, briefly touch in on supplements. And just before we get there, I think, most of you are probably familiar with this, but probably bears repeating just to go over, what do we mean as far as supplements? So that's anything from energy drinks to vitamins and minerals to herbal remedies. And then it goes into all of the fun stuff that all the athletes love to purchase without thinking. So probiotics, protein powders, fat burners. It's great. Whenever I ask an athlete, like, oh, are you taking supplements? They're like, oh yeah, I'm taking a vitamin. And then as I do their diet history, it's like, oh yeah, and I'm on this probiotic, and I use protein powder, and I have a pre-workout. So oftentimes they get confused. So really important to dig a little bit more if you are asking this question, and probably highlighting some of these categories is really important. What I also wanted to point out is when we're talking about supplements with our athletes, it's really important that they're aware of the sport certifications that are out there, and especially if your athlete is someone who could get tested and is in the pool, they really need to be aware that not all certifications are created equal. So what we're looking for is an accredited lab with the ISO 17025 accreditation. And that basically enables them to detect the majority, not all, of potential banned substances. So you guys are probably familiar with these, but just in case, the first one is NSF certified for sport. Important to know though that not all products are tested. So they are batch tested, and it is important for the athlete to cross-check the ID number on the batch. So they can do that. There's an app, and they can also do that online. The second one has two components to it, which is informed sport and informed choice. Now, informed sport, all batches are tested and certified. So as national team dietitians, we are recommending first and foremost, go with informed sport. It's the safest option. However, there's not as many options in Canada. So the same thing applies with informed choice. Not all products are tested, so the tubs just need to be verified. So just wanted to put that out there in case you're unfamiliar with the testing of sport products out there. And also it's important to note as well, there are health supplements that have these accreditations as well, because as you know, vitamins and minerals also fall under these categories and are unregulated. So if you are, recommending a vitamin D. There are some iron products, but not available in Canada right now. So we're hoping they'll come over. But yeah, there are supplements that do have these sport certifications. All right, so what ones do have some potential benefit when it comes to this situation of, a multi-race over successive days? So if we're talking pre-event, and again, I'm going to highlight these pretty briefly, and if you have questions, I'm happy to go into it one-on-one, and you're welcome to email me or post them afterwards. So pre-event, we do know that creatine has some ergogenic benefit when it comes to repeated sprints. So the athletes would need to be taking creatine for a minimum of 5 days pre-event. Interestingly, we get some backlash around creatine around racing because it can be associated with some weight gain. There was a great study that showed even within a time trial with multiple hills repeats that the extra weight actually had no impact, and that creatine added performance benefit for those athletes. So I like to cite that one a lot. So yeah, so it's something that we use with our athletes. Also, beta alanine is another. This is a buffer. So again, in terms of repeated sprints where you're going to see that buildup of acid within the muscle, the beta alanine can be quite helpful, and also adds a training bonus in terms of capacity. So again, something that can be done pre-event. Beta alanine needs about a month loading period, so it needs to be thought about in advance. If we're talking day of, in terms of pre-race, beetroot juice or sodium nitrate. Now, this is generally for more of your team pursuit type of events, point race, something that's a little bit longer. It's generally about kind of anything over about 7 minutes, you'll generally see a little bit more benefit with beetroot juice. But again, still, still beneficial in certain events in track cycling. And caffeine, we all know in terms of kind of the sensory perception, and lots of evidence to show some ergogenic benefit to that. So something else we tend to use with the athletes. Again, something to keep in mind with caffeine is when we're talking about crits or track events where there's races in the evening and then the athletes will be racing again. One thing to really keep in mind is, and again, if the athlete is complaining of insomnia or any of those issues, is check in, are they using products or specifically supplementing with caffeine, because that can obviously cause sleep disturbances and can definitely disrupt their recovery. So sodium bicarbonate, yet another buffer. This one is used acutely. Big one with that one to watch for, as you're probably well aware, is taking large amounts of sodium bicarbonate can have some really bad GI issues. So hopefully any athletes that are using this have tested it in training and won't be doing it first time at competition. But obviously that can be one of the side effects. So important to ask about that if an athlete is complaining of GI issues. And in terms of post-race, this is where, again, protein would play a role. So whether that's dietary, but we do have, athletes that it's just easier especially when they're traveling in unsafe environments, or just from a tolerance perspective, we'll use protein powders. And then the other one that's kind of come up more recently in the literature, both from an anti-inflammatory and as a provision of higher content of melatonin, is tart cherry juice before bed. So as I mentioned, that's a really brief overview, but what I did want to point out, and I have this in the references as well, is there's a couple of really great reviews. The IOC consensus on dietary supplements for high performance athletes is absolutely excellent and goes through each of these in greater detail. And then also optimizing recovery to support multi-evening cycling competition performance is where you'll find a lot of this information. And again, relates these supplements specifically to the context we're talking about right now. So if you're at all interested in more detail or finding a little bit more about any of these supplements, I would highly recommend looking these papers up. They're, as I said, both excellent. All right, so to finish off, I wanted to go back to our sample race day and just look at, give you an idea of what this looks like once we integrate the supplement component in this as well. So, I'd mentioned tart cherry juice. I omitted that. You do need to use it. The recommendations are 30 mils twice a day. So we might mix it in at breakfast and then again later in the day. Creatine would be something the athlete would be taking regularly. So can be mixed in any time. We do want them to be taking it with carbohydrates, so I generally have them do it with a meal or a recovery snack. And then in the case of sodium bicarb, we wanted them to be taking it about 2 hours before their race. And then I threw in the beat it shots in there as well. So you can see that it does add some significant it's some significant work on the part of the athlete. There's a lot of things kind of going on, and so they do need to be kind of organized and have a really tailored plan if they do tend to want to use supplements as well. So I've showed you where caffeine can fit in as well in the pre-race. highlighted sport drinks, just in terms of kind of the sodium provision as well. And I think that's it in terms of the additions. So there's kind of a complete plan if you're interested, just as a reference point. So I wanted to finish off just by troubleshooting a little bit when it comes to symptoms. And this is in relation, again, if you get, an athlete coming to you with some complaints that, they did a multi-day race and had some issues. And I think, probably from your standpoint, you have way more things than I do to think about. But if you're like me, sometimes you miss the obvious. So I thought it would be worthwhile kind of going through a couple of the, the complaints that may come up and some areas that you might be able to draw some nutrition conclusions from that would hopefully save you from going down some rabbit holes. So GI symptoms, some possible causes that could be related to nutrition. Certainly something simple like meal size. I've had athletes that try to eat these gargantuan meals before they race, and then they wonder why, they're sitting on their bike with cramps and burping and, and totally uncomfortable. Also, as we talked about, high fiber content, especially when they're trying to meet those carbohydrate targets, you really need to be mindful of, like, get rid of the whole wheat, get rid of the bran muffins. It's time to go for all of your high, just white staple foods. So also fat and protein, obviously harder to digest. So those are things that can be mitigated as well. High fluid volume as well. If they're taking in obviously too many fluids, and especially if there's not enough sodium, or if they're taking them apart from meals where they're just not absorbing them as well. If they're taking them all in at once, we really try to encourage athletes to do this over a period of time, because that can result in cramping. Drinking too fast, obviously an issue. High sugar or fructose content can be problematic as well, especially if you're dealing with any athletes with IBS. You really want to watch, take a look at what is the breakdown of the carbohydrate that they're taking in. And there are, if those of you who are comfortable using low FODMAPs, there are some specific sport foods that are more conducive to a low FODMAP diet. And also, of course, use of, like we talked about, bicarbonate, caffeine, or beetroot can also result in GI symptoms. So worth, again, just kind of probing them to see, what types of supplements or the contents of various products that they're taking. In terms of fatigue, possible causes, pretty obvious here. Inadequate energy, carbohydrate, or fluid intake can all result in fatigue. And also, I wrote this down too, is creatine use without increased fluid intake. So when an athlete starts using creatine, and especially if they've just done a loading phase leading into a competition, their fluid needs really increase. So you really need to be mindful that if they're not aware of that, they could be very dehydrated and be totally unaware, thinking they're drinking the exact same amount as they usually are, which they probably would be, but their body just needs a lot more. So just something to be aware of there. Headaches, possible causes there, again, inadequate carbohydrate or fluid intake. Always good to just do a quick check and see what they've been having. And muscle cramping, I always like to point this one out. I'm sure you guys are pretty aware, but everybody always goes right away to electrolytes. Really important to just look at basic fluid intake. A lot of athletes think like, oh yeah, I just didn't take in enough salt. I'm like, well, did you drink water? Like, this is a big part of it. And another big piece is carbohydrate, which they don't think about. So that can also result in cramping if they're not taking enough of that in. So just remembering, I think, hopefully this is just kind of making it a little easier on you, is before you get into all the nitty gritty and go down into your toolbox, is just some of the simple stuff like timing, size of meals, composition of, any of their food supplements or fluid intake, and it might make your job a lot easier. So I wanted to include in my my slides some references and kind of practical sport nutrition information. You guys all know how to look up all the papers, but sometimes just having some good websites to refer your patients to can be really helpful. So I wanted to give you a couple of those. And then also these are some of the references for some of the information that was shared. So with that, you're welcome to pose some questions. It looks like there might be some available, or again, you can email me directly at mspringle@csiontario.ca. So thank you so much for sticking around and for your patience. And let me flip back. Oh, actually, sorry, I'll flip back over. And there we go. Okay. All right. So, Wade, I'm conscious of time here. How would you like me to do this? Do you want me to answer some of these, or should I
maybe just answer a couple, or if you want to respond to them after just on typing, that would be fantastic.
Okay, perfect. All right. So, oh, hi, Richard. Nice to see you again, too. Well, hear from you. And okay, preferred green non-whey protein powder or supplement preference. So great question. Lots of vegan athletes now, or just athletes who prefer not to use a whey protein. So in terms of preferred, I will reserve, I don't want to, say I'm preferring any specific brands, but I would say definitely first thing is refer them to the NSF or the Informed Sport websites and get them to type it in like vegan protein, and a bunch will come up. So that's first and foremost. You want them on a tested product. And to be honest, my personal bias is even if the athletes are not getting tested, just the regulations that go into the testing of these products and the horror stories that I'm sure most of you guys have heard about some of the contamination of products that are on the shelf, I would highly recommend that they go with a tested product regardless. So that said, there are a whole bunch out there. And so what I tell them to look for is, the main thing is looking at the leucine content. You want at least 2 grams of leucine, because that's the one amino acid that is kind of our trigger for muscle protein synthesis. And that's the one that sometimes with your vegetarian proteins, you won't get enough of. Most of them on the market are pretty well aware of that. And so they do mix them appropriately, but just to be aware of. So yes, no product endorsement, but there are lots out there. All right. So intolerant to dairy. So that's a great question. And on that note, if you do want to use food sources instead of dairy, best bet would be soy. So soy is going to have all of your essential amino acids, whereas again, some of the vegetarian proteins won't. So that's my first option with dairy intolerant athletes. If it's just lactose, tons of lactose-free options, so go with that route. But if it is specifically dairy, we would work with soy. And if soy isn't an option, that's where, again, we have to start being creative around using some different protein sources, plus maybe some alternative milks, potentially a protein powder. So just really depends. So why is whey or casein the preferred protein? So whey, we're looking, is a much more fast-acting protein. So we want to get that right in the post-exercise or recovery windows. So that really stimulates muscle protein synthesis. Whereas casein, you're looking at a slower-acting protein, so better for preserving muscle degradation or preventing muscle degradation, which happens overnight. So that's where you want to make that differentiation. So really important that your athletes aren't saying like, oh, okay, I'm just going to buy casein protein and use it after training. Really not effective. So make sure if they're differentiating that properly. So whey after training, casein overnight, or just use dairy. It's got both of them. Go figure. Someone knew what they were doing. All right. Oh wow, there's lots. Okay. Okay. Where are more products that are Informed Sport certified? The US, where they don't regulate nutraceuticals as much as Canada. Where can we tell athletes to find these products? Great. Hi, Marnie. So, yeah, it's so nice to see so many names I know. So in terms of the Informed Sport, it's a bit of a newer designation. It's more popular in the UK, but it is more and more sports are understanding sport products are understanding the differentiation and are going, the ones that want to go and target elite athletes are now moving more towards the Informed Sport. So yeah, it's heavier in the UK, but there are options available, and Informed Choice and NSF are still really good options. It just takes the athlete that extra step to actually cross-check, which, as we know, athletes are sometimes lazy. So that doesn't always happen. So you just have to make sure you're on top of it. And in terms of finding the products, thank you for bringing that up. As I mentioned on the websites, they can go on, each of the websites they can search terms. So whatever they're looking for, creatine, protein, whatever, it'll come up with a full list of products that are available. And then they should be able to find out whether they're available in Canada or US or UK.
Probably we should kind of end things. I think we're
okay, I will type some answers to the rest.
Fantastic, Nicole. But I just want to thank Nicole. That was fantastic talk and very informative. And I think it's helpful for all of us because we don't tend to do this on a day-to-day basis. And I always look to you for advice as well. And just wanted to also thank Emily again too. And Emily, thank you again for your talk. And it is getting a little bit late. I will let Nicole type a couple of answers there. You also have her email if you need to ask any questions. Other than that, we are going to be same time, same place next week, different speakers. And thanks everybody for attending.
Thanks everyone.